When I look at the patients that come to me for pregnancy care, they're very thankful and appreciative. I'm going to get started here pretty soon. But honestly, I think the gratitude of patients in abortion care is even more profound. Here at OHSU, we care for those patients just like everybody else. Historically, abortion care started in big medical centers and hospitals. But a number of political factors led to a shift out of hospitals into freestanding clinics. That was in many ways a big step forward in the way abortion care was provided. However, it also had some downstream consequences. Abortion providers began to be viewed as outside the mainstream of medicine. They're kind of viewed as rogue physicians. We have close affiliations with the clinics in town. We have our medical students and residents and fellows and faculty working in those settings as well. And I think that's a really good thing.
Good afternoon, Downtown Women's Center. Yeah, we do provide abortion services.
We've been here over 30 years.
Have you had a positive pregnancy test?
We're a small clinic, like you would go to see just your regular doctor if you had a cough. There are many OBGYNs that don't provide abortion services in their own particular clinics for multitudes of reasons. They are pro-choice and they can do the procedure, but they choose to refer their patients to come see us because they feel like we're the experts. As a clinic, that's all we do.
Do you have a sense of when your last period was approximately?
We work very closely with Oregon Health Sciences University and their fellows and residents. It's super important to all of us and all of our doctors that we train the next doctors.
Hannah?
Yes.
Hi, I'm Dr. Pettigrew. It's
Nice
nice
to meet
to meet you. Come on in. This is Dr. Newhall. I'm the physician that's going to be doing your procedure today. It's a very short procedure, but it can be intense for a minute or two. Abortion care is simply just one aspect of full scope family medicine care. I mean, when you take a procedure that, a third of all American women will have experienced, it's very common and it's within our skill set. It just naturally fits in family medicine.
I'm a maternal fetal medicine doctor, retired now. We would take care of the pregnancies that have abnormalities. If we were worried that the baby couldn't make it and we offered the mom an abortion or termination of pregnancy, we had to decide where it could be done. And very few of the areas in Oregon outside of Portland can do abortions. So we would ask that the pregnancy be terminated at OHSU.
Nobody that comes through my clinic is interested in ending a pregnancy. That's not their goal. But when they hear about what's going on, when they hear about what's the life ahead, you just heard a new word called schizencephaly, and you don't realize that means that the anterior part of your entire brain isn't going to work, that your cognition isn't going to work, that you're not going to be able to see or have meaningful interactions or eat on your own. And to eliminate somebody's option to get respectful, caring, expertise care, it's not acceptable.
Right. We are very fortunate to work here, but also to be in Oregon, where there aren't the limitations as there are in many states. And even later in pregnancy, when there's a really serious anomaly, we're able to help out.
To be able to rely on you, Mark, and your team who do such a good job of being not only full of expertise, but also compassion and empathy for everybody involved. We're very lucky.
I was a women's health care nurse practitioner with Multnomah County Health Department for 35 years. The county didn't do abortions, but we certainly saw a lot of women who just found out they were pregnant, weren't sure what they wanted to do. If there are members in the community that aren't supportive of abortion, then it creates barriers, fracturing of the referral and access process.
So now that we've gone over your medical history, I'm just going to
I
describe.
was always pleased with the quality of the counseling that went on in the clinics that offered abortions in town and the time they spent with young women talking about their options. You need a community to have a viable service.
It was never a question of is the work worth doing. It was more of an how is this going to impact maybe my career choices in the future, and also how is it going to impact my family? Are there going to be protesters on my lawn? Am I going to be nervous starting my car? Are people not going to want to come see me for other OBGYN issues because I'm an abortion provider?
Great, that's going to go under your toilet. Can you lift your hips up one more time? One more.
Mark was able to really assuage all of that. I mean, he is the epitome of a general OBGYN. He does absolutely everything. That really helps you recognize and can really incorporate the entire reproductive lifespan of a woman into your career, and that was really inspiring and important to me.
Okay, perfect.
Oh, there he is.
Okay. Good job.
Yeah, baby. Congratulations. He's quick, didn't he?
There was a private practice patient of mine that had a wanted pregnancy, but she got so sick to the point where she was desperate and her family was falling apart. So at that point, she requested to end the pregnancy. While I technically was allowed to do an abortion in that hospital, I was basically told that if I did, there would be doctors in the community, primary care doctors, that would not refer patients to my group practice anymore. And I was the youngest person in the practice and not a partner, and I chose to transfer her to another hospital. Internally, there was all this support for providing abortions to our patients in both of my practices, but externally, they didn't want anyone to know about it. I basically had to say, I will add patients in.
That's kind of how it is in our practice too. It's like the folks that do abortion care will do it on their off hours or their admin time or their lunch hours, and it's fine and we're happy to do it, but it's a little extra.
Yeah, and it has to be MA. That's
The entire appointment's long, but the procedure part is really, really short, so about 3 hours total. In the early 90s, there was so much violence going on. We were literally terrified to come to work some days, but not so terrified that we weren't going to come. Like, the terror wasn't going to keep us away. Women's choices in general have always been super important to me. We want a woman to come here, feel safe, feel proud, no shame in choosing a very reasonable medical procedure in whatever situation they happen to be in their lives.
I enrolled in a program that matches physicians who live in areas where there's a higher number of providers with communities that need people.
You're going to actually go to Kansas to work there as well?
Yes, I talked to this woman. She's opening another clinic in Oklahoma City. And she has 2 physicians currently that she flies into Wichita because they don't have any providers that do second trimester procedures.
I recently met with a group of medical students and we went over the uterine aspiration procedure that can be used for abortion or miscarriage management. And there's this really fun model where we use a papaya as a pretend uterus. Oh, let's go just through the instruments. We talked a little bit about, these are called manual vacuum aspirators, or MVAs for short. When I was a trainee, there wasn't much training in abortion care. We think it's really important to prepare our residents to be able to take care of women who need abortion care, who need help with miscarriage management when they have early pregnancy losses, and who can help women get whatever kind of contraceptive choice they want, especially IUDs, implants, etc. So you're going to feel firm, and then a give. Not very many of my residents go out and actually become abortion providers, but many, if not most of them, are able to manage early pregnancy loss. And then you take your aspirator and you get this ready. I'm gonna insert the flexible cannula, and there you get the seeds coming through.
Oftentimes patients are walking into a hospital that may have a name that doesn't sound Catholic at all, and yet the doctors are not allowed to offer a full range of options.
Frankly, some other medical centers kind of view abortion as dirty work and they just don't want to be involved.
Had a young woman, the placenta was separating from the wall of the uterus and she was having really heavy vaginal bleeding. And she was coming from a hospital system that's a faith-based hospital system. And so even though her life was in danger, they could not perform a termination for her. It's not that the physicians don't want to help, but their hospital system is what limits their ability to act. And I think it's kind of an easy out for them to be able to say, oh, well, good thing OHSU's here, we'll let them handle this.
Do you have any last minute questions for me at all? I don't think so. No? Okay. A lot of times people say, why do women get abortions? Or do you ever, when you ask women why they get abortions, like what do they say? And I say, honestly, for the majority of procedures I do, I have no idea why they're getting an abortion, because I don't ask. You're gonna feel my touch down here, the hand above, okay? Because as long as they are certain, I'm not the one to decide if it's the right thing for them. One thing that the pro-life or anti-choice movement has done really well is to use imagery, sensational imagery, use grotesque imagery to their purpose.
You did great. Yeah. Are the cramps still bothering you? Yeah.
Right.
Okay. It does take a little while, but they are going to get better.
So there's a pregnancy right there. There it is right there. All right. So everything went really well. The way we look at abortion is promoting a better future for this woman, for her family. I am in a bubble in the sense that I'm an abortion provider who works amongst colleagues who do the same thing. And then I live in Portland in Oregon. We're in a state that's very supportive.
Oregon is an unusual place. Access to abortion is not available everywhere, but it's available. For many people in many places in this country, it's a huge challenge.
When I went down to Kansas to interview, it was a big freestanding clinic with a big fence around it and surveillance cameras and crosses planted down the side of the road next to the clinic and protesters, and it's a very different experience. I'll spend 2 days, twice a month in the clinic there and then come back when I'm done. I think there's a huge diversity among people who provide abortion care and what brings them to it, but I think there's a core value that women's lives and their autonomy is of utmost importance, and helping them through a difficult time is what matters the most.